the patient.
Ayan, kami punta pa na, ayan tumama ba na dala.
So yeah.
Sorry,
Go ahead.
We have an hour thereabouts, and basically it's your hour to try and answer your questions and help you move forward. You sent us some questions last week. I don't know whether that's the starting point or
Yeah.
I'd like to run through those questions.
Yeah, that'd be great. So, obviously, when I saw you, I had already quite a history of gynae issues. Why wasn't I given an MRI as a starting point
So
for my
we met
care?
in May 2014.
Yeah, when I was first hospitalised in May, I came into hospital in May following seeing you. I came to hospital May the 1st, and that's where they diagnosed me with a PID. But I was given no ultrasound that day. Then I was given a following ultrasound at High Wycombe. However, I wasn't given an MRI, and as you all know and should know, that endometriosis cannot be picked up in an ultrasound, and even in an MRI, it's very very lucky if that they do pick it up in an MRI. But even still, without the cost of having a laparoscopy, why wasn't I given an MRI?
I can only say from what we met in the Children's Health Clinic on the 22nd of May. So I wasn't involved with your emergency admission. Your emergency admission
Was in the beginning of May, yeah.
I mean, there wouldn't have been, I don't think there would have been an indication.
But that's what triggered the meeting for me to see you.
I don't think there would have been an indication to have an MRI. I mean, we don't offer MRIs to all patients where you're suspecting endometriosis.
But you treat with the medication of that I had. You were treating me as though I had endometriosis without actually clarifying I actually did have endometriosis. That's what my problem is.
That's right, and I mean, I think that is something that, you know, looking back, and perhaps when I'd written to you after, I mean, you came to me with a history of having had a laparoscopy in 2008 under Miss Ashworth, where you had thought that laparoscopy had shown endometriosis.
Yeah.
And I think that's what you shared with me during the consultation.
Yeah.
I went back to Stoke Mandeville to look at the notes because, as you know, in the
Yeah.
Fairford clinic we can't access
2008 to 2014 is a bit of a time. You can't really go on what I had in 2008 because, first of all, endometriosis either can grow rapidly or it can grow slowly. So I already had the beginnings of problems in 2008. Whilst she didn't find it, if she can actually spot endometriosis is another matter. She didn't find it. Okay, fair enough. But in the end of the day, I was hospitalised in May, vomiting violently, stomach issues. Nobody knew what the problem was. Yet the ultrasound that I had in High Wycombe, the lady who, and I've got the copy of here, she said it's pretty much likely it's either endometriosis and it looks like she's got adenomyosis.
So it was because of the adenomyosis that I felt that medical treatment was the better treatment for you.
Yeah.
And I didn't think a laparoscopy at that point would have changed our management because the ultrasound scans you'd had at that point didn't suggest you had an endometrioma that needed treatment.
You can't see it though with an ultrasound.
Well, you can if they're large enough.
Right, okay. Or if they're in a bad position,
what
you can't.
What you can't always do, and I think because you had several scans and the MRI you eventually had did show you had a small endometrioma of 2.4, and I expect it's because actually it was only a small endometrioma but large enough to be causing you symptoms that was the reason why it wasn't seen on those earlier scans and why you had several scans that one time seemed to show a cyst and another time not.
Because they burst.
Always small areas.
But every time they found a cyst and then there wasn't a cyst, it's because they were bursting, and that was every time I was getting ill every single time. Now, you put me on the Decapeptyl. Now, that's treating me as though I've got endometriosis. However, you haven't actually clarified I have got endometriosis. All it did was mask my symptoms. Yes, I was pain-free for 6 months. However, what you can't quantify is the anxiety, the panic attacks, the non-sleep, the body pain, the joint pain, all the other things that came with taking that injection. Yes, I had no periods. Yes, I was pain-free with periods. However, my life had completely taken a complete 360 change. My life had changed in 6 months. Yeah, I had to start taking anxiety pills, and I'm still on them, and they're increasing now. I'm actually even further into my anxiety journey than I was at the beginning, because that's how much it's affected my life. Once you start, that's it now. I have to take sleep pills to go to bed. I have to take anxiety pills every day. I've been made redundant because I'm constantly ill. You have to understand that it's not just the one thing it's affected. Yes, it fixed my endometriosis for 6 months, but the minute I stopped, the first cycle I had, bam, I was in hospital. Next month, bam, I was in hospital. Every single month after that, I was hospitalised, and not because I was faking it. I was vomiting, bleeding heavily. I still wasn't treated as though I was urgent enough to have a laparoscopy or an MRI. I had to beg and plead after 6 days in hospital in March to get an MRI. And by this point, I'd already asked to start being transferred over to Oxford. Now let's look at how I get treated at Oxford. One phone call, I think I've got this going on.
Yeah.
I've been given this XYZ. Right, no problem. Let's see if we can get you an MRI, and then we'll see you straight away. What was the difference when they saw me to when you saw me? He straight away said, Mr. Arenbaj said, I've seen enough. We need to give you a laparoscopy. Straight away. No. Let's get on medication. Straight away from March the 9th to July the 8th, when I had the operation. Done. With you, May, and I still hadn't got anywhere. May 2014, I had to get moved to JR in the March 2015, because you still weren't fixing me. So how many hospitalisations did I have to go through for you to actually say, do you know what? This girl needs a laparoscopy. How many times?
I think
She looks like a number to me.
How many times?
She's a number, not a person. I feel very cross about it.
I'm sorry, she's
A number.
She's being treated like a number. Yeah.
I mean, I think that's something we can look at, and we were talking.
And how many women? It's not just me. It's all the women in Aylesbury and Buckinghamshire that get this treatment.
And there's a lot. There's a lot of people.
I think where our care is not joined up, which is a pity, and what hasn't helped you, is your emergency admissions haven't necessarily linked in to the named consultant. And I was your named consultant in so much that we'd met at Fairford-Lees.
Yeah.
But then I wasn't involved with your care when you came in as an emergency.
Why not though?
Well, I think that.
How many times did I have to beg? How many times did I have to plead? How many times did I have to talk?
So
How many gynecologists did I see, and not one of them talked to you? With all my medical notes, and you say you've got a record of all my medical notes. You're telling me not one person in the gynecological team could have married up. Not one.
I think that is a very
it is a very good point.
Well, it is a good learning point, and
Learning, absolutely.
It's something that we really need to do. Because if I know that one of my patients has been admitted, I would want to follow that through and know when they're coming to clinic. I'm afraid I do that a lot.
Can I just?
But when I saw you in the March, and I'd already been hospitalised twice by this point. Well, 3 times if you count the May.
We met, and I hope you had a copy of that letter. We met on the 19th of February in my gynae clinic. And
when the lost notes happened, and you did and if you've got endometriosis in quote marks.
Like you've just done to
me. That's what you did to me. That's actually what you did to me. My husband was absolutely. But to do that to someone who might have endometriosis and turns out that they actually do have endometriosis is actually disgusting.
Well, I'm sorry about that.
You know, it's very disgusting to make you feel that your pain isn't real, because that is saying it's not real. Yeah, that's what you were meaning by that. If you have got endometriosis, if I had it. Now, my husband was there as witness. That played on my mind, and I can't tell you how many nights I lost sleep thinking about you doing this to me when I was violently sick or when I couldn't stand for my cramps.
Could I just pause for a second? I just want to answer your question before we discuss this aspect a little bit more, if that's okay. You asked why you had to wait the sort of full year before the surgical treatment was embarked upon. The discussion.
You didn't. Sorry, can I stop you? You didn't embark on any surgical treatment.
No. I'm just. Your question was why wasn't surgery discussed, or why didn't you have surgery as an offered treatment earlier on? And Ms. Hall was explaining that your symptoms were that of pain, the scan had occasionally shown a cyst that had come and gone, but at that point, there were choices about treatment options, and because of the additional finding of adenomyosis, which is a similar type of condition to the endometriosis, medical treatment would have been effective for both of those conditions.
Right.
And that's why the
So,
GnRH analog 6 months injections was recommended.
Yeah.
And it does, looking back on it, when you came off it, your pain was
It
dramatically
was exacerbated,
worse.
actually.
Well, that's not often the case. The intention of treatment with those injections is to actually allow time for the disease to calm down. And
I
quieten down.
understand that.
And for many patients, it is an effective treatment.
Yes, it is.
But in your case, it wasn't. And I think the circumstances had definitely changed by the time you moved into this year and you had those hospital admissions, those emergency admissions. And you're absolutely right that the situation then did change. But I think looking back at the first time you were seen in the previous year, 2014, exploring medical treatment was a very appropriate form of treatment to recommend.
Right. Yes.
Does
Okay,
that make sense?
No, it makes sense. But the problem is, when I went to JR, this is what my biggest issue is how two hospitals that are not next door to each other. Who, in my mind, I thought when I was before all of this, I thought hospitals talk to each other. I thought they all work and operate in the same way. Turns out they actually don't. It turns out they actually don't. And because when I went to them, he said, I wouldn't have done that. I'd have given you a laparoscopy first, and then I would have put you on it.
Yeah.
Then I would have put you on the injections, because then that would have really put it at bay. But he said, because you've had it for 6 months, I can't even give you that treatment after, because you've already had it. You're only supposed to be on it for a limited amount of time. Am I right? Am I right in saying that?
But I think that's.
I think for longer. Sorry.
You can use it for longer, yes,
use it
but
for
yeah,
longer
but the side effects you have.
If you have it without back treatment,
Yeah.
I mean, it depends really at what stage you are,
But-
what you're treating, and whether fertility at that point.
Yeah, it was
is an issue.
and this is another thing that I love that.
She didn't have no help from
You
day
understand?
one.
So you're telling me that I shouldn't?
From
I
day
wasn't
one,
warranted.
it's a number, that's it.
I wasn't warranted a laparoscopy to investigate endometriosis. However, 5 years of infertility should have been enough.
I mean, at that point, my notes actually document that you weren't trying for a pregnancy.
Well, I can't try for pregnancy because I'm infertile.
Well,
but
when you see someone in clinic for a consultation about endometriosis, you have to determine really whether you're treating the pain and the problems from endometriosis, or whether fertility is an issue at that point in time. You told me very rightly that you wanted to retain future fertility, but my notes suggest that you weren't actually at that point when we first met.
But you should
But that's my right as a human being to have a child. I can have a child whether it's up to me or not. It's got nothing to do with what you recommend. The problem was there was a problem inside me that wasn't dealt with. That's what we're dealing with here. There was a problem that wasn't dealt with.
Yes.
For 14 months. Now let's not, because you said about with the surgical route. You didn't push for any surgical route. I pushed for it. I begged you on the 19th of February. I begged you to do something. I was barely walking at that point because it was pressing on my nerve. I was barely walking. I had to beg you for a laparoscopy. I had to beg. And even then, it wasn't even an excision. It was laparoscopy by ablation. I don't want that. I want excision because I know, because I do my research and I understand endometriosis, that the only good way of dealing with it by laparoscopy is by excision. Ablation actually exacerbates it. Do you know this? Probably not, because you know what? You're not an endometriosis specialist, and that's what my problem is. If you do not understand endometriosis in all its complexities, you should not be seeing anybody. You should not be allowed to say. That's like me saying, I'm going to treat you for your bad knees, but I know nothing about knees.
Well, I think
Because gynecology is a very broad subject. You've got from birth to fertility. Which is your specialism?
I'm a general gynecologist.
Right.
And I mean, endometriosis, I have a broad knowledge of endometriosis, but it's not my specialist area.
Exactly.
And when you went to the John Radcliffe, yes, you were seen by
A specialist, yeah.
in endometriosis. And if you look in my letter that I sent you on the 19th of February, two things.
You suggested Jane Moore. Please don't bring that up because I suggested it to you.
Well,
in your letter, you've put that you've suggested that you should see Jane Moore when it was actually me I knew Jane Moore. I knew all her team. I knew all of that from my own research. So please don't sit there and say that you suggested I see Jane Moore, because that is not what the problem is.
The letter is here. It says.
Yeah, of course it is, but that's what I suggested it in the meeting.
No,
I suggested it in the meeting.
But that's what it says here.
I
in this
don't have.
letter.
I personally, I'm sorry,
That's
you
why
do.
it's wrong.
I don't have a problem. I see a consultation as a partnership, and if a patient has suggested to
Well,
me that they would like, that they feel that their best treatment option, and I agree that that would be the best way forward.
I didn't agree though. I was I
Not
didn't
to
agree.
go to Oxford?
I didn't
wasn't
agree.
there.
No, sorry. I didn't agree to have I did not want to start the analogues. I did not want to start the generic analogues. I said to you in Fethleys, I would really prefer to have a laparoscopy first. But no, you said no, that's not the treatment course. That's not partnership. That's you telling me I can't have an that I have no choice. I have no choice in the matter.
Well, I'm sorry, and I think that is one of the things perhaps I should
You're saying it's a partnership, it's not.
Well, at the Fairfordleys, I mean, looking back, I can see I didn't document laparoscopy, and it may well be that when I'd written to you with what we found, or not found.
You
in
can't
the
find
2000
endometriosis by the eye or hand.
No,
You
no.
cannot feel it.
Miss Ashworth's laparoscopy in 2008. Perhaps I should at that point have said to you, or given you the choice of the GNRH analogues or a diagnostic laparoscopy. And
I didn't have a choice though, did I?
Well, and my letter didn't actually mention laparoscopy as well, but
No,
I still feel, I mean, the main reason I wasn't, but I mean, you could have come back to me at that point and said you weren't happy to take the GNRH analogues. My main reason was the adenomyosis, and I still feel it was a sensible approach to use a GNRH analogue to treat your adenomyosis.
The point is, my dear, that you need to change your view. You need to change your way. You need to specialise a bit more. I'm sorry
Or just
to say.
you shouldn't see anyone that's a suspected endometriosis case.
When you
That's what I see. And unfortunately, Aylesbury's a very small place, and when I was in Ward 16B, I got to talk to a lot of patients, and a lot of them are under you, and I know a lot of them personally now. They've become my friends. Now I know that they've had the same horrendous treatment, and your bedside manner is appalling. Your bedside manner is appalling. I'm not the only one who feels this way. There are a lot of girls in Aylesbury who are going through what I'm going through. But sadly, unfortunately for me, there's no way back for me, because now I've got fibromyalgia.
It makes you look
I've
like
got-
she's got all in
You
her
make
mind.
that. That's how you make people feel. Like endometriosis is just, it's a little cramp. It's debilitating. It is soul destroying. You don't treat people like they're soul destroyed. When I saw Mr. Arenbaj, he said, "I'm so sorry, my dear, you've gone through this. Let's hope we can make this better for you." That's all you need. That's all I needed, was for someone to say, "Do you know what, my dear? I'm so sorry. I'm so sorry. You are going
She's
through
been
this."
through hell and back.
That's all I wanted. And as a woman, I would expect it even more from another woman to say, "Do you know what? God bless you. You're going through so much pain." But do you know how you make people feel? You make them feel like, let me write my notes. Oh, she's fat. Yep, she's got BMI. Yeah, her BMI's high. Yep, I'm a person. And I'm not the only person that's got this. You've got to understand what endometriosis does. It can go from, I could have stage 1 and be in bed all day, and you could also have stage 4 and be okay. This is the complexities of endometriosis. This is what you don't understand, and this is why you should not be allowed to see anyone about endometriosis.
Can I respond to that, Ms. Gunn? Because obviously you've commented on the fact that we have generalists at Stoke Mandeville, and that is the case. All of our consultants in Obs and Gynae are generalists, and we all participate in general gynae clinics. And then if we need some expertise, if we need specialists...
Wait for the patient to find them.
No, that's not the case. We do internally make referrals to particular consultants who have more expertise in certain areas, and that is a standard way of working. And if we need even more specialist referral, we would consider making referrals to another hospital.
I'm sorry to stop you there. You do that at the very end of the feather when they cannot take anymore. You should do that much earlier than that, dear.
It is not possible.
That's
it's not
the
possible
problem.
within the structure of a small unit
That's the
to
problem.
have specialism right immediately at the initial referrals.
You should have been there.
But
when I had to cuddle my daughter like a child.
when it's quite simple, all I had to do was pick up a phone.
Yeah.
I said, hello, Carol. Yeah, I think I've got endometriosis, but they won't give me a laparoscopy at Stoke. Okay, my love. Let's get you referred over to me.
Can I just respond? That isn't actually fair, because during the February consultation, you had asked to be referred to Oxford.
Yeah.
It was a conversation you had
Yeah.
with Ms Hall, and it was agreed.
Yeah, of course
that
it was
she
agreed. She
going
wanted to wash her
refer
hands of me. She couldn't wait.
That's not true.
But
That's not
also,
true.
I mean, you asked for your laparoscopy to be performed at Stoke Mandeville, and I said because we were considering endometriosis with your scan showing a possible endometrioma, I would refer you to my colleague Mr. Dada, who does more complex.
That's impossible because I had the I had the MRI on the 1st of March. You saw me on the 19th of February, so that's impossible. I hadn't had the
Yes,
MRI at that point.
No, because your scan had also. But I knew you
Sorry,
had.
which
No, I'm sorry. I had referred you to Mr. Dada for your laparoscopy in anticipation that if we found significant endometriosis, it would be done as a one-stop laparoscopy by Mr. Dada. Whereas, as you rightly said, I'm a generalist. I would treat minor areas of endometriosis, but I wouldn't do the deeper excision of endometriosis if endometriosis was found.
Yeah, and that's what you offered. Do you remember the phone call when you phoned me one evening and you said, "Do you remember?" And I said, "It's okay. I've already been. I'm already got the ball rolling going to Oxford." And you said, "Well, I can give you an investigative." Sorry, even my speech is affected from my fibromyalgia. I can't even get the word out. Anyway, you could offer me that surgery before Mr. Dada, and I said, well, there's not much point because I'm in care of JR now. Yeah, you that in the complaint. You've got no record of that phone call.
No, we haven't.
Yeah,
I'm
funny
sorry,
that, isn't it? Am I making that up as well? Is
No, I
that
don't think you are making
phone
it
call?
up, but I'm really sorry, and I can't recall exactly how.
It's too complex.
This is the problem, you see. This is the problem. 1 in 10 women suffer with endometriosis. It's quite a high number. 1 in 10 women are going to you. 1 in 10 women are going to have the problem that I'm having. But yet they might not be strong enough to say, do you know what? I'm not going to take this anymore because I've had such a bad year that all I do is think about my endometriosis journey and what it's done to me and how it's affected my life. And I felt so strongly that I had to complain. But what about all the other women that haven't felt strong enough to do that? What about the girls that have got their bowels attached to their wombs and now they can't have children and they have to have fallopian tubes removed? No, but this is the reason why I'm doing it, because it's too late for me. I'm done now. This is it. It's over for me. What I want to happen is that you're not going to treat other women like the way you have me, because fertility is quite a big thing. Because when someone tells you can't have children, that's all you can think about. And endometriosis can grow very rapidly. And if you see a patient and you don't deal with it there and then, in your 14 months of timely response, they've already probably lost a lot more of their fertility. That's what you need to understand with it. And you have no sympathy at all in that situation of the gravity of not being able to have a child. I'm a person.
Can I respond to that, Ms. Gunn, because obviously you've commented on the fact that we have generalists at Stoke Mandeville, and that is the case. All of our consultants in Obs and Gynae are generalists, and we all participate in general gynae clinics. And then if we need some expertise, if we need specialists...
You wait for the patient to find them.
No, that's not the case. We do internally make referrals to particular consultants who have more expertise in certain areas, and that is a standard way of working. And if we need even more specialist referral, we would consider making referrals to another hospital.
I'm sorry to stop you there. You do that at the very end of the feather when they cannot take anymore. You should do that much earlier than that, dear.
It is not possible.
That's
not
the
possible
problem.
within the structure of a small unit.
That's the problem.
To have specialism right immediately at the initial referrals.
You should have been there.
When it's quite simple. When all I had to do was pick up a phone.
Yeah.
I said, hello, Carol. Yeah, I think I've got endometriosis, but they won't give me a laparoscopy at Stoke. Okay, my love. Let's get you referred over to me.
Can I just respond? That isn't actually fair, because during the February consultation, you had asked to be referred to Oxford.
Yeah.
It was a conversation you had with Ms Hall, and it was agreed.
Yeah, of course
that
it was agreed. She wanted to wash her hands of me. She couldn't wait.
But
That's
also,
not true.
I mean, you asked for your laparoscopy to be performed at Stoke Mandeville, And I said, because we were considering endometriosis with your scan showing a possible endometrioma, I would refer you to my colleague Mr. Dada, who does more complex.
That's impossible because I had the I had the MRI on the 1st of March. You saw me on the 19th of February, so that's impossible. I hadn't had the MRI at that point.
No, because your scan had also. But I knew you
So
had.
sorry, which
no,
is it?
No, I'm sorry. I had referred you to Mr. Dada for your laparoscopy in anticipation that if we found significant endometriosis, it would be done as a one-stop laparoscopy by Mr. Dada. Whereas, as you rightly said, I'm a generalist. I would treat minor areas of endometriosis, but I wouldn't do the deeper excision of endometriosis if endometriosis was found.
Yeah, and that's what you offered. Do you remember the phone call when you phoned me one evening and you said, "Do you remember?" And I said, "It's okay. I've already been. I'm already got the ball rolling going to Oxford." And you said, "Well, I can give you an investigative." Sorry, even my speech is affected from my fibromyalgia. Investigative. Oh, I can't even get the word out. Anyway, you could offer me that surgery before Mr. Dada, and I said, "Well, there's not much point because I'm in care of JR now." Yeah, you that in the complaint. You've got no record of that phone call.
No, we haven't.
Yeah, funny that, isn't it? Am I making that up as well? Is
No, I
that
don't think you are making
phone
it
call?
up, but I'm really sorry, and I can't recall exactly
Yeah.
how.
It's too complex.
This is the problem, you see. This is the problem. 1 in 10 women suffer with endometriosis. It's quite a high number. 1 in 10 women are going to you. 1 in 10 women are going to have the problem that I'm having. But yet they might not be strong enough to say, "Do you know what? I'm not going to take this anymore because I've had such a bad year that all I do is think about my endometriosis journey and what it's done to me and how it's affected my life." And I felt so strongly that I had to complain. But what about all the other women that haven't felt strong enough to do that? What about the girls that have got their bowels attached to their wombs and now they can't have children and they have to have fallopian tubes removed? No, but this is the reason why I'm doing it, because it's too late for me. I'm done now. This is it. It's over for me. What I want to happen is that you're not going to treat other women like the way you have with me, because fertility is quite a big thing. Because when someone tells you can't have children, that's all you can think about. And endometriosis can grow very rapidly. And if you see a patient and you don't deal with it there and then, in your 14 months of timely response, they've already probably lost a lot more of their fertility. That's what you need to understand with it. And you have no sympathy at all in that situation of the gravity of not being able to have a child.
There's no word for that.
I'm lucky. I've managed just about scrape by to pay for my son to be born, and I had my miracle. There are a lot of women in this world that can't afford that.
I think I would have, if you were trying for pregnancy when you came to the first consultation, I would have recognised that, and I would have referred you on to the fertility clinic at Stoke Mandeville.
My fertility is a side issue. My point is,
that's exactly.
I'm not complaining about you wrecking my fertility, because I know my fertility was an issue way before I got married.
If there's any indication that giving you the GnRH analogues for 6 months would have.
I'm not saying that it did. That's not my complaint.
Oh, sorry. I thought.
No,
I just misunderstood what you were
my
saying.
complaint isn't about the GnRH wrecking my chance of having another child. My point is
endometriosis wrecks people's chances of having children. That's what my problem is.
I'm very aware that endometriosis
Are you?
causes fertility
Are you?
issues.
Well,
Yes.
because it doesn't seem like you treat it as an urgency in this hospital.
She's very
How many
young.
times?
I understand that
My
she's
husband was
50.
accused of cheating on me when I came in when I came in March 2014. When I came in violently vomiting, plotting, you name it, I was in a really bad way. Yeah. I was diagnosed with a PID and given 3 lots of antibiotics. And you know what the doctor said when he came round, the general doctor, in an open ward where everyone can hear, are you and your partner faithful to each other? Yes, we are. Been together for 14 years. I would highly recommend you double check. Now, you tell me how that makes a woman feel. It's disgusting. Is what it is. It's disgusting. And then to later on, I get by pushing my GP, I get an ultrasound done, and the ultrasound shows I've got adenomyosis and maybe endometriosis. And then in May, I get to see Miss Hall.
But that's not.
You tell me how I can't be as angry as I am.
This is not something that was in the content of the
No, I know.
your complaint.
But this is
And
this
it
is
is
where
not
this is what
actually-
brought me to here. It's not just Miss Hall I've got a problem with. It's Stoke Mandeville as a whole.
The old
But this,
Ham-
system is
we
wrong.
can't address this.
No, I know,
We
but
just need
I
to
want to
talk
make it
about,
known.
I mean, some of the issues you raise about sort of our pathways of care, we can, and that's
we absolutely
yes,
can. Yeah.
So I think we want to make things more streamlined if we can, and then we've taken your points on board. The other thing I'd like to just say, because you said I didn't organise an MRI, but actually from the 19th of February we had actually booked the MRI scan.
Yeah. How many months ago after? Because I begged you to do it.
But that was all.
But you still hadn't done it, yeah.
Consultation.
But you
But
see,
that's
that should have been
consultation.
addressed from you
That's
months before.
consultation.
She had to push.
I
for
was
that.
I was
there.
hospitalised in the January. Why wasn't I given an MRI? Why wasn't it? Yeah, you can't answer that
No,
because it's just,
January.
there's no communication between emergency
The needs
and
of
you.
it.
Well,
we've-
you're
and we've
right.
recognised
You're
that.
absolutely
So
right. and
January, February, you organised an MRI.
that is the case. You're right in pointing out that your emergency admission failed to communicate well with your named consultant, but within a month you were then seen, and at that point an
I already
MRI
had that appointment
requested.
booked actually. That wasn't already that. February the
February
4th
was
was
already a
already
follow-up,
booked.
yeah.
Thank you. So it wasn't. I was treated as an emergency. That appointment was already there.
But then, I mean, Ms. Hall had commenced a treatment just over 6 months previously and was anticipating seeing what your response to that treatment was.
No. She wasn't actually.
But then
We
why
saw
was
her
that
in. I
follow-up?
saw her in December. I saw her in December, and that was pretty much. I was. That was it. It was a foregone conclusion. It's over. It's done with. Your treatment's finished.
The appointment was arranged.
Yes.
The May 2014 was a perfect lease clinic.
Yeah.
where we
All of
was-
them were until February.
And follow up. So I did follow up in Fairfield Leeds
December,
from
right.
the December. In December, Annabelle had a lot of problems with GNRH analytics, which she shared with me, like she has done today, and had a myelina coil in situ, which had been fitted by her GP, I think July of that year, and she had an appointment planned to have the myelina coil removed and asked me to remove the coil, and I removed the coil, and at that point she was fortunately pain-free, so I discharged her from the clinic, because at that point she told me or shared
So
with
how
me.
was-
Because I didn't want to see you anymore.
Well, I'm sorry about that, but you shared with me you were trying for a pregnancy, you were pain-free, your examination showed that you were less tender, so it seemed appropriate at that point to discharge you from my Fairford Leeds clinic, which is what we did. But you then had your emergency admission in January, was it?
And
You
the
came
February.
through to my clinic, but my Stoke Mandeville clinic in
So December to
February.
January, it's not very long, is it? Why
It
this
literally was
investigation is
14,
being done
I think
in
it was the
time?
14th of December, funnily enough, and literally the first cycle, 28 days, not even 28 days later,
No.
I was in hospital.
Which very much confirms.
Yeah, very much
Endometriosis-
confirms that what I
endometriosis is a
felt was
problem.
right. But yet you still, in February, you still had the gall to stand above me and do that. That's actually what you did. My husband recalls it as well. He said, please don't forget today to remind her how she did that. You actually stood, and if you've got endometriosis. You're even making a bigger point. You're not even doing it from sitting down. You actually
See, it's
consciously
not
made
written down, the gesture.
a
that
point
you
to do that. That,
It's not like she's a
appalling.
mad lady. Yeah?
yeah? Do you understand that?
She's
Do you,
33, she
do
should
you
have a
accept that that
okay.
is unacceptable behaviour? As a doctor, as a bedside manner, accept that. Do you accept that that's not acceptable? To stand and do that?
Well, I would
yes,
say
I do,
it
and I
is
mean,
not
I'm
acceptable
not sure
because
what
of the
happened when you
implication
recall.
of such a gesture would make, and it would be very unusual for Ms. Hall, and I have been a colleague of hers for many, many years. I would be in support of her compassion and her normal behaviour, and so it is.
Try not to cover up, love, because that offends
There was no
my
compassion.
intelligence.
I'm
Try not to cover up.
I'm stating.
Please don't do that. Please.
I'm
Stop
stating
there.
as a fact
I suggest
that
you
I
stop
do not
there,
have
because
an
that makes
issue.
me very angry now. Very angry.
She's
This
never shown
child-
me compassion, ever. In not one
Yeah.
appointment have I ever felt compassion.
Well,
Ever.
I'm disappointed that that's the way it's.
I haven't
been.
actually felt compassion
because
in
it shouldn't-
any person I've seen in this, apart from the nurses. any gynecologist I've seen. Do you know what one gynecologist did? This is what they did. This is what they showed me. I've still got the drawing in my paperwork at home. She drew a picture and she went, yeah, that's Patch Douglas.
She's no doctor.
These
She
are-
don't need this diagram.
I've
She
got the
need
internet.
action. She
I've got the
need
internet.
facts.
Thank God for me that I had the internet and I could research. And someone said, you know what? You need to see an endometriosis specialist. What do you mean? Wouldn't the doctor I've been seeing is an endometriosis specialist? Turns out you're not. But you see, only because I investigated and talked to other people, they said, you know what? Are you seeing an endometriosis specialist?
But I'd like to take. I'd like to comment.
How can
that-
one hospital not have one
Miss Tusker,
specific
we-
endometriosis specialist?
We have generalists, we have consultants within our department who have expertise in treating endometriosis. But if you have severe
I didn't, luckily for me.
No, but if you had, then we would have definitely wanted to refer you to a tertiary
So you wait
centre.
until she
And we
dies.
do-
Yeah,
no,
wait
not
till-
at
till-
all. I mean, our investigations will give us indications to when the endometriosis is severe enough really to need to be treated in a tertiary centre rather than at
I
St
reckon she
Andrew.
had more than an indication, my dear.
But could I-
More than an indication.
Could I just once again explain that
10 days in
the,
hospital wasn't enough.
the
no.
timeline is such that you were treated through through 2014. You did receive medical treatment
Yeah, I
for
did, yeah.
endometriosis, and for many patients that resolves the disease, improves the symptoms, and therefore doesn't require any further specialist
Resolves
input.
it.
It does. There are many.
Do you understand
patients
endometriosis is like a
No,
weed?
I think you're
Do you
wrong
understand
there.
that endometriosis is like a weed? If there is a
Yeah.
root, it will continue growing. Even a hysterectomy doesn't cure endometriosis. Did you know that? Do you know that hysterectomies don't cure endometriosis? The only thing they cure is adenomyosis. If endometriosis can grow as far as your nose, if there is endometriosis still inside you, if there is one little bit, if endometriosis can grow as far as your nose, if there is endometriosis still inside you, if there is one little bit, it can spread and spread and spread and spread and spread in time. Mine took 8 years. From 2008, there was no endometriosis. Yeah? You tell me how that, you as specialists can't understand that. Endometriosis does not disappear with GnRH. It just mollifies it. It just stops it. That's all it does. It just stops it for a bit. Just stops the symptoms. It doesn't eradicate
cure
it.
it.
The only thing that eradicates it, and it even still doesn't eradicate it, is excision. By getting the root of it and getting it out. I've even got a video of my operation. I didn't ask for it. JR said, here you go. I didn't pay anything. I've got a video of what endometriosis looks like. If you want to see it, you can have a look. Because this hospital doesn't understand endometriosis, because you yourself have just told me that GnRH gets rid of endometriosis.
No, I didn't say it gets rid of it. I said there are many
you didn't
patients.
say it.
I said there are many patients who
In-
are better.
it's in
and
the
do
many
not
words
Yeah, you do
I said
get
that.
better. You get better, but it doesn't. No, you did
And
say
the
it. We'll look at
circumstances
the
are very
recording.
different.
Well,
Every
you've got
patient's
recorded
journey
there.
is different, and many patients are better and may well not require surgical input beyond that. And that wasn't the case with your condition.
You
What
just
were?
mask
but it
the
just
problem.
puts it at bay.
You mask the problem. You need to investigate a bit more. You need
The
to be more
operation-
thorough.
But the problem is, as a cost-saving initiative, not to give me a laparoscopy. Do you know how much I cost you now? Now I've got fibromyalgia. Do you know how much I cost you? I dread to think. I'm in and out of the doctors all the time now, prescriptions all the time. I fainted, broke my ankle. That was another hospitalisation. I've got to go to Guys and Thomas for fibro. So now, as you saving an operation, okay, cost saving in one
That was-
operation
that was not
has
the
now cost
intention.
you, has now cost the NHS even more, because now I am tied to you for the rest of my life, because I've got anxiety, depression, and fibromyalgia. I'm going to be in this cycle for the rest of my life. And as a result of you saving one operation, it's actually cost the NHS double. Who knows? Couldn't tell you the price, but it'll be a lot
We're
more than just one
simply here
operation.
to make things better for the future, for the
I-
women in
it's not going to make a difference because they don't understand endometriosis.
in the world, I would say,
They
because
don't
all of the
understand
cases
endometriosis,
present
so
problems.
it's pointless. There's no specialist who, in my opinion, you see, this person's got endometriosis, right, let's put her to this person. No, we don't. We just give it to
With
And it
mask,
turns out there's
with
not
a-
one there's not
with an
one
injection
specific
of,
endometriosis consultant apart from the surgeon.
This is how the NHS works.
Really? Well, it doesn't work like that at JR
But
though.
that's what
No,
we're
I
here
don't-
for. That's what we're here for.
I
We
think
want things to change.
am I correct in thinking that
No,
a preliminary?
The college, there is college guidance, RCOG guidance, the Royal College of Obs and Gynae, about the first line treatment of endometriosis or suspected endometriosis, and seeing a generalist and addressing the symptoms that were troublesome at the time is appropriate, and that's what has happened.
I don't
In
think
your
it is.
case,
I
your
don't agree.
condition
I
has
don't-
deteriorated. Despite having the GnRH medication, as soon as you came off it, things had deteriorated, and within a couple of months, you had then been offered the MRI and the referral to Oxford, or within discussion between yourself and your
Begging.
consultant.
Begging.
Yeah.
Yeah.
Between yourselves, an agreement that that was going to be the management plan.
But that's the point.
Yes, but
And
my
that's-
point
she
is,
had to
I had to
for
beg.
it.
I had to
It
beg
wasn't
and I had to plead. It
suggested,
wasn't
but you could
suggested.
beg
It
for
wasn't
it.
suggested.
Well,
Please don't tell me that it was suggested. Please don't look me in the eye and say you suggested it, because you
But
said
she
you
suggested.
First of all, let's not forget. This is one very important point on the 19th of February. I wasn't due to see you, was I? I was seeing Junior. She didn't have any of my notes. Not one note. And the poor girl didn't even know anything about endometriosis, really, or adenomyosis. Didn't have a clue.
Just was
And then
waste of
only
time.
because I demanded to see you, did you walk in the room. Thank you. That's actually, it's just recalling me. You're saying that you suggested this, that, the other. I had to say, actually, no, I was here to see Miss Hall. I want to see Miss Hall. And then you walked in the room, and then I told you, I'm planning to move to JR, and you said, fine, we'll get you referred and we'll order an MRI in the meantime.
So
yeah?
it wasn't from
So
your
it wasn't
part.
because of your suggestion and your compassion and your expertise. It was because I demanded you walk in the room and talk to me face to face.
Well, I
So you didn't suggest it.
I
I
would,
suggested it.
I would always see a patient with my SHO. SHOs are fully supervised in clinic, and if the consultation hasn't, if they haven't managed to either, with follow-ups, all my new patients that the SHO see, I would see as well, and depending on the follow-up consultation,
Yep.
then a lot of those patients I would see as well, and I would have seen you anyway.
You
with
wouldn't
my
have seen
SHO.
You wouldn't have seen me, dear. You would not have seen me at all. I was sat there waiting for
believe
2
it.
hours for a start. So when me and my husband sat there for 2 hours, sitting and waiting, and we walk in the room. This isn't Miss Hall. And she was giving me the consultation. She was giving me the consultation, not you.
Again,
So
this
please don't
is-
say you were going to definitely see me, because you weren't. I demanded you walked into that room that day.
Can I also?
And
make
you looked very flustered, and you were like, "Oh, the notes. You couldn't find the notes. Oh, they shouldn't. Oh, where are they?" And then you couldn't actually remember me. Actually, you were trying to place me because you couldn't remember where you saw
I
me.
probably remembered your name.
Do you know what?
but
Mr. Arenbaj saw me one time, and as soon as he walked into the ward, he went straight to me, Annabella. One time he saw me. You saw me 5 times. You didn't recognise me.
I've seen you on 3 occasions. I'd seen you twice before at Fairfordleys, and those Fairfordleys, and it's the linking up with Fairfordleys.
You see,
and-
all
But
these-
that's my point.
So
These
all
little
this
things
linked to the
add.
fact that my daughter was nearly mutilated. All that.
I could,
When
I could,
I go
if I could,
She had the
if I said
IVF.
yes to have a hysterectomy, you'd have given me one.
I
Yeah.
would not have done. I'm
She
sorry.
was prepared for it. What do you mean you didn't give her one?
No,
She was prepared
But
for it.
I thought that was my only next
No,
step.
not at all. I think we had a discussion on the 19th of February about hysterectomy and adenomyosis, but at no point did I recommend or would have performed.
I wouldn't have let you.
I would not have
What you've done
or
for my friend,
offered
Jesus.
a hysterectomy.
Ms. Gunn, we've recognised that there are some areas that we definitely need to improve in terms of accessing notes in a comprehensive way, having that continuity, and when you have an emergency attendance, making sure that the named consultant gets to know about your case and therefore makes the appropriate follow-up. So there are definitely areas that we must improve. However, this is a small district general hospital with generalists. Initial consultations will be done by generalists according to standard recommendations from the college, and that is what's done. Yes, if your condition doesn't respond to treatment, then further investigations and further referral to specialists are required. And it might have been that it was yourself that was pushing for that, but it got to
My point
you
is,
got to
what
that
about the women who
treatment
don't
point.
push?
But there are many patients who are satisfactorily treated with that course
No,
of
there are
action.
many patients
That aren't.
are
What about
ignorant.
the ones that aren't? What about the ones that aren't? Are you going to go away from
But
this
we can't-
meeting and all the women that are on your books that are in a similar situation as me? Are you going to say, right? Do you know what? We need to do things differently here. Let's look at them case by case and let's actually look at their problems. Are you going to do that?
Well, I think we do approach pelvic pain. I mean, when you get a referral with pain, you don't necessarily know that that is endometriosis.
Then what we have
You had
under-
No.
now-
Sorry, can we just have this
Yeah.
one finished? What
You
she's
had a
saying?
there were a lot of indications from your history and examination that we were dealing with endometriosis from the beginning.
Yeah.
And I mean, I recognised that. And
Oh, yeah, I know you
agree with
recognised
what-
it. My point is, you dealt with it wrong because the laparoscopy comes first. Laparoscopy, GNRH. Contraception.
Not necessarily on, if you look at sort of the college guidance, medical treatment may have been indicated, but what it does say is that some patients, and I respect that, prefer to go down a laparoscopy to have a definite diagnosis. And yes, I perhaps should have made it clearer that that was an option. But I think because you'd already
No. You made it
because
clear it
you'd
wasn't an
already-
option. Let's get
because
that right. You made it clear it wasn't an option.
and that may have been
That you made it clear it
because-
was not an option. That is not
Because-
giving someone an option by not giving them an option.
Can I say where my thought process may have been that you'd already had a laparoscopy? And we
In
do-
2008.
Yes, but you have to be careful not to be
6
doing
years.
too many
6
repeat
years.
laparoscopies.
Do you know what the average diagnosis time for endometriosis is? Do you know?
It's between 7 and 10 years.
Right. Oh, so you do know that. Is it because I put it in the letter that you found that out, or did you
No,
know?
the-
Okay, so if you knew that, and if you knew that, why were you using my laparoscopy from 2008 as a guarantee that I didn't need a laparoscopy?
Could you just allow Ms. Hall to respond?
I don't understand. I don't
Are you
understand
not-
it.
are you-
Why are they bringing up something in 2008?
They cannot, Anna, because whatever they do, they're going to mask the problem
Yeah.
here.
I think we're wasting.
I
our
just
time.
hope that they learn from
Yeah, they
it,
won't.
but they won't. Because so many people and so many women I talk to, they got the same problem as you, but they haven't got the guts that you and me have. Simple as that. I want that to be recorded because it's the truth. That is the truth.
Okay.
So many women get mutilated of the ovary and everything else without further investigation.
All right, this was for your daughter to
Sorry,
discuss
but it's
her
my daughter,
concerns.
it's my flesh and
When
blood.
it comes to when it's your flesh
It's
and blood and
appropriate.
someone's in the position, you'll see it.
Appropriate for this meeting
Yeah.
to do that. Do you feel that you've had an opportunity to put forward how you feel? And to
Yeah,
draw
that's
the
pretty
meeting?
obvious.
Are
Yeah,
we going to
it's
explain-
safer to close for you because you're
no,
not
do you feel
you're never gonna fix what's happened to me because no apology is gonna fix my problem now because I'm gonna be with this for the rest of my life. So just know that your impact, how important your impact and your interactions with every patient you see, realise the importance of what effect it has, because I don't think you realise when you stand over someone and you say endometriosis, you remember me and think about your using a bit of compassion, because that's all I ask. Or one doctor, one moment, all he did was touch my arm and say, "My dear, I'm sorry."
Ms. Gunn, we have heard that, and we
And
do
I-
apologise if that was what happened during that consultation, and we are sorry that that happened. However, Ms. Hall does not deserve the some of the criticism that you've
Really?
laid at her.
Okay.
And I would defend her as a very good colleague and a kind and compassionate doctor. So I don't accept a lot of your criticism,
Okay.
but I do understand that if there were gestures that were made during consultation and that shouldn't have done, it was an error, and it shouldn't have happened. You're absolutely right that shouldn't have happened. And we will try to improve our pathways, and we will try to make things better. And
What I would suggest is you suggest every woman that walks into your doors with endometriosis, tell them to go to JR. That's what you should do. Because you have no idea about endometriosis, because GNRH fixes it. When you understand endometriosis, then you should be treating them.
It's a very complex thing.
Yeah, and I
You
don't.
have to be there to understand that.
I hope to God none of your children or anyone you love or ever suffers the way I have. My life is ruined now.
Shall we?
No, you want to finish because I'm saying my life.
That's
So
my
my life will
interest
never
to
be
you.
the same. It's irrevocable with what I've been through.
I'll just show you.
I know where